We're ready to begin.
Oh, I love these colors too.
Fun, right?
I got your thing.
Oh, you did? Okay. The link.
I didn't get to do it, but I did get it.
I think we're ready to start okay, great.
Great.
Hi, everybody. Good afternoon. Good to see you all here. Today is Monday, March 2nd. I'm Delegate Emily Shetty, Chair of the House Subcommittee on Health and Social Services on Appropriations, joined by my wonderful Vice Chair, Dana Jones, our awesome committee counsel, and colleagues on the subcommittee. Today, we are having our hearing on the Department of Human Services Family Investment Administration budget. We'll start, as we always do, with our DLS analyst providing her testimony. So Tanya Zimmerman, we welcome, and we look forward to hearing from you.
Thank you, Madam Chair. Turning to page 1 of the analysis, this shows the fiscal 2027 budget change by fund. Overall, the budget decreases by $92 million, or 3.6%. If you turn to page 7, that begins the discussion of the performance, but I'm going to start on page 8 with Exhibit 1. This looks at the application trends for the 3 main benefit programs. During the recertification, the extension of recertifications during COVID, applications were very low because a portion of applications each month relate to closures. After the end of the recertification extension, the applications increased substantially for SNAP and have remained elevated compared to the pre-COVID period, and have generally been higher in calendar 2025 compared to calendar 2024. As of December 2025, applications were about 18% higher than pre-COVID levels. TCA's applications are relatively near where they were pre-COVID. However, TDAPs have increased substantially in each recent year, and as of December 2025, were 57% higher than pre-COVID levels. Turning to page 9, Exhibit 2, this looks at the average days to process applications. In general, applications are to be processed within 30 days, though expedited SNAP applications are required to be processed within 7 days. As you can see in the exhibit, this results in substantially lower average days to process SNAP applications compared to TCA and TDAP. For the most recent period, the most recent complete quarter of data, the average number of days to process applications for TCA is about 7 days higher than SNAP and about 9 days higher than for TDAP. In general, average days to process TDAP applications has declined over the last couple of years, and TCA has remained relatively level. SNAP application processing times have increased, and in calendar 2025, it's about 13 days compared to about 10 in calendar 2024, likely related to the higher number of applications. Turning to Exhibit 3 on page 11, this looks at the application denial rates. Application denial rates are considerably higher throughout the period for TCA and TDAP compared to SNAP. For TDAP, it exceeds 75% in all quarters of data, and for TCA, it also is generally above 70%. All 3 benefit types, TCA, TDAP, and SNAP, experienced their highest or second highest in the case of TDAP application denial rates in September 2025. For TDAP, it was 92%. TCA, it was nearly 87%. And for SNAP, for the first time in the period of data availability, it exceeded 40%. Overall, for SNAP, the application denial rates have increased compared to the calendar 2024 period. Turning to Exhibit 4 on page 13, this looks at some of the causes of denial for TDAP specifically. Overall, TDAP has more program requirements that result in more closures for particular reasons. Through January 2025, they had not reported separately closure or application denials that were related to the not meeting the disability criteria. That was reported as part of the no eligible members category. Combined, these two categories are generally the leading cause of application denials for TDAP and are generally over 30%. Turning to Exhibit 5 on page 14, this looks at closure or application denials related to non-cooperation with child support. Chapter 457 of 2020 altered the sanction policy for non-cooperation with child support to reduce the benefits by 25% rather than closing cases. DHS may still deny applications for failure to cooperate with child support. And the share of application denials due to this reason began to substantially increase in calendar 2024. And since that time, it's been among the top reasons for denial in all months. The highest level of denials during that period was in August 2024 at 21%. It's generally come down since then and was 6% in the most recent data available in October, but that's still higher than the earlier period. Moving ahead to page 16, Exhibit 7, this looks at case closures by quarter. Generally, for SNAP, these have increased since the earlier periods. This largely has to do with the implementation or enforcement of the able-bodied adults without dependents work requirements that were suspended during the public health emergency. Also, during this period, the upper age limit was increased through the Fiscal Responsibility Act, and in the most recent periods, the jurisdiction level waivers that were in effect through June 30, but have expired and resulted in case closures. However, overall, the case closures were lower in the most recent quarter than some of the earlier periods impacted by this. TCA closures have increased in each of the last 3 quarters. A portion of this relates to improved reporting related to cases that closed because their income was too high. However, TDAP closures have increased in all but 1 quarter since April 2024, and were at their highest level of just under 4,200 in the most recent quarter. Turning to page 20, this looks at a couple of the specific program reasons for case closure. Beginning with TCA, federal law prohibits cases headed by an adult from receiving TANF-funded cash benefits for more than 5 cumulative years. However, federal law provides the option for exemptions due to hardship. And you can exempt up to 20% of cases due to a hardship exemption. Historically, DHS granted hardship exemptions to all cases reaching the time limit, so few, if any, cases were closed. To resolve an audit finding from a fiscal compliance audit released in October 2022, but contrary to longstanding practice, the department began closing cases reaching the time limit without a documented hardship exemption. These closures didn't really begin to increase significantly until state fiscal 2024. As shown in Exhibit 10 on page 21, prior to November 2023, 50 or fewer cases were closed each month due to reaching the time limit. However, they began to substantially increase after that period, peaking at just under 2,100 in December 2023. In calendar 2025, about an average of 255 cases per month closed due to this reason, which is about 11 to 14% of closures. And overall, between November 2023 and October 2025, about 9,700 cases have closed due to this reason. Turning ahead to page 22, this looks at case closures in the TDAP program for some of the specific program requirements. Similar to the application denial programs, the reasons the disability criteria wasn't reported separately for a period of time. However, since that time, closures due to that reason have increased and generally exceeded 30% in 6 of the last 7 quarters. Moving ahead to page 24, this begins a look at some of the issues related to the fiscal 2025 closeout. Language in the fiscal 2025 budget bill restricted $5.8 million in general funds and then the same amount of federal funds in the assistance payments program to be transferred to the Director's Office and Family Investment to be used for administrative expenses for the Sunbucks program. These were funds that were intended for that purpose. Under the language, funds not transferred were required to be reverted or canceled. And however, at closeout, DHS failed to either transfer the funds or revert the general funds. They indicated that this was due to an oversight, and we've asked the department to discuss any changes to its processes to ensure that language in the budget bill restricting the use of funds for particular purposes is followed. On page 25, this looks at some of the fund split concerns of the Department of Legislative Services related to the closeout. Family investment administrative programs are funded with a mix of general, special, and federal funds. The federal funds are from a variety of sources, primarily TANF, SNAP Administrative Match, or Medicaid. SNAP Administrative Match and Medicaid generally have a 50% federal match, though some expenses have a higher match, and in some instances, third parties pay the state share of the match. However, the reported expenditures in fiscal 2025 for the administrative programs appear to have a higher level of federal funds than could be supported with the general funds that should be matching it. Exhibit 13 on page 25 or 26 shows the general funds relative to the SNAP administrative match and Medicaid funds, federal funds combined in recent years. As you can see in this period, during the early periods, the general funds and the combined SNAP administrative match and Medicaid are relatively level, which is what you would expect. However, there is a large discrepancy in fiscal 2025 between the reported general funds and the federal funds that should have matched. DLS has similar concerns with how these are shown in the director's office, and can also have concerns about the fiscal 2026 working appropriation and 2027 allowance. And we've asked the department to comment on how they could have general fund expenditures of less than half the reported expenditures of federal SNAP administrative match and Medicaid when they require a dollar-for-dollar match, and how they will ensure that the actual expenditures better align with available federal matches in fiscal 26 and 27. Beginning on page 26, this looks at some of the impacts of the federal government shutdown and the response in the Department of Human Services to recipients of SNAP and feeding organizations due to the shutdown. However, I'm going to just focus on one particular area on page 28. This relates to the funding that was provided under the state of emergency from the Fiscal Responsibility Fund to support SNAP benefit costs. $62 million was provided overall. DHS used the funds to ensure that all households received at least 50% of their typical benefit. The federal government provided 65% allotments. However, that's like a recalculated benefit based on 65% of the allotment. So not all households received 65% of their benefits, and some received less than half. So they used the funds to ensure that everyone received at least half. They began issuing the benefits on November 11th and ultimately used about $2.7 million of the appropriated funds. The remainder of the funds are unneeded and are part of the proposed transfer from the Fiscal Responsibility Fund to the General Fund and the BRFA, and DLS recommends deleting the unneeded funds. The department also issued the full $50 supplemental benefit for seniors, reflecting both the typical state benefit as well as the federal share. They anticipate being reimbursed for the extra benefits that they provided, and we've asked the department to comment on the status of the reimbursement. The bottom of page 28 and the top of page 29 discuss the status of a grant that was added for the Maryland Community Action Partnership as of December 30th. No funds have been expended from the grant, though the department indicated they were working on a grant agreement, and we've asked the department to provide an update on the status of the grant agreement and the timing of the distribution of the funds. Page 29 begins the discussion of the proposed deficiency appropriations. Overall, they provided $32.3 million, $23.5 million of which is general funds, $5 million of special funds, and about $3.8 $8 million in federal funds. The largest is $28 million related to the SNAP payment error rate penalties in federal fiscal 2023 and 2024. Though the penalties are under appeal, the funds will be are provided in the event the appeals are not successful. I'm only going to discuss one other deficiency appropriation, which totaled $11.7 million, including $8 million in federal funds and $3.8 million in general funds for the employment and income verification contract to align with the anticipated contract costs and utilization. DHS had indicated that the overall deficiency amount, particularly related to the federal funds, was higher than needed, and DLS recommended deleting the overstated funds. Turning to page 30, this looks at the cash assistance benefit levels. Under state law, the governor is required to provide sufficient funding to ensure that the TCA benefit, when combined with the SNAP benefit, equals 61.25% of the Maryland minimum living level. This is updated annually for inflation using the May inflation numbers. The SNAP benefits are typically announced in August of each year. In August 13th, 2025, USDA released the maximum monthly allotment for the period beginning October 1, 2025. For a household of 3, the benefits increased by 2.2%. The May inflation numbers indicated there was a 2.4% increase, and so DHS calculated that the benefit would increase for a 3-person household for TCA by $20 per month. For a 1-person household, the increase was $8 per month. This is also used for the benefit level for TDAP. Historically, the calculation has been made in advance of the start of the federal fiscal year so that the benefit changes would coincide with the changes in SNAP. In a break with historical practice in the last 2 years, DHS has not provided the calculation until after October 1 and not began the benefit increase until January 1. It's unclear why they've broken with historical practice to not calculate, to provide the benefit increase at the same time as the SNAP benefit increase. In fall 2025, DHS seemed to indicate it was because they did not have the information needed to complete the calculation before October 1. However, as previously noted, the SNAP benefit change was announced on August 13th, and the inflation numbers were available in the summer. For federal fiscal 2026, the delay was particularly concerning as the federal shutdown delayed the full issuances of SNAP benefits, and this could have provided additional assistance to TCA and TDAP recipients. And we've asked the department to explain the rationale for not providing the required benefit increases until January, despite having calculated the benefit increases, and DLS also recommends restricting funds pending the submission of the calculation on October 1 and an explanation if the effective date is after October 1. Turning ahead to page 34, this looks at the more detail on the benefit changes. As shown in Exhibit 17, the allowance decreases by $92 million. The largest share of these decreases is $72 million related to needs during the federal government shutdown, and $28 million is related to the SNAP payment error rate penalties. If you exclude those one-time funds, the fiscal 27 allowance of FIA would increase by $8 million. Turning to page 35, I'm just going to highlight a couple of items on this page. Overall, the assistance payments changes align with anticipated caseload and benefit levels. The one that I would note here is the EBT fraud replacement. This assumes 80% savings for 3/4 of the year due to the new technology that they plan to implement. Moving down to the contract and grant changes, there's about $14 million of decreases in the Maryland office for refugees and asylees due to impacts of declining refugee admissions, as well as changes in the eligibility period for benefits. Turning ahead to page 37, this looks at the recipients by program since July 2023 for TCA, TDAP, and the supplemental SNAP benefit. Overall, the TCA recipients have been declining The year-to-date average is just over 47,000 and is lower than the level that the budget is based on. However, DLS does anticipate growth in the caseload in fiscal 2027 due to the economic uncertainty. The TDAP recipients have increased in nearly all months since reaching a historic low in June 2022, and since April 2024 have exceeded the pre-COVID levels. Since March 2025, it's exceeded 13,000 in each month and even exceeded 14,000 in 1 month. It's unclear precisely what is driving the increase in the TDAP caseload. These are primarily long-term cases that are driving the increase or the largest share of the caseload growth. So DLS is continuing to forecast growth in that program. I would note that the SNAP supplemental has a kind of 1 month spike that has to do with how they provided the additional assistance during the shutdown. Turning to page 38 and page 39, this looks at our forecasted expenditures in this budget. So unlike typical, we didn't provide kind of a singular forecast for whether we believe the department is short or has a surplus. This is due to the higher than typical degree of uncertainty in the funding and in the activities of the programs. The uncertainty stems in part from the fiscal 2025 closeout errors and the uncertainty around the TANF balance, as well as the assumptions about savings in the EBT fraud replacement program. After the implementation of the new technology, this is based on the experience of a single state, which is the only state so far to have implemented that technology, and as well as assumptions about the availability of federal reimbursement in the TDAP program. DHS receives federal reimbursement for benefits under TDAP for cases whose applications for SSI or SDI are ultimately approved. The department's reported higher than historical levels of federal reimbursement in fiscal 2025 and fiscal 2026 year to date. It's unclear if this relates to the federal government working through some backlogs in their caseload or improved processes of the department, as it's considerably higher than recent years and really higher than any year dating back to 2002. So if you look at page 39, Exhibit 19, we've presented kind of two estimates that are kind of a range of what we think could happen. The low end is basically like if their assumptions played out, and we would think that they're generally okay, maybe a little bit short. On the high end, if the assumptions about the savings from EBT fraud don't happen, or the TANF is available at lower levels, we would have forecast shortfalls of exceeding $12 million in fiscal 2026 and $32 million in fiscal 2027. Exhibit 20 presents, on page 40, presents some information on the SNAP caseload and recipients. Generally, these have declined over the last several years. And the fiscal 2027 allowance includes $1.66 billion in federal funds to support SNAP, which is the same level as the fiscal 2026 working appropriation. The fiscal 2025 actual expenditures were $1.49 billion, and the average monthly number of recipients was higher than it is year to date. And so DLS is recommending reducing the SNAP funding by $200 million to better align the allowance with recent experience. Turning to page 43, I would just note that DLS is recommending adopting committee narrative, requesting information on the Sunbucks program participation, and expressing intent that their administrative costs be budgeted in the planned area of expenditures. If you are interested, on page 42, it presents information on participation by jurisdiction. Issue 1 begins on page 45. This relates to the impacts of the One Big Beautiful Bill Act. You have already had a number of briefings on this topic, so I'm going to just highlight a couple of areas. We've asked the department to discuss its partnership and collaboration with the Department of Health and other agencies to reduce the impact of OBA on changes on customers. Looking at the ABOD participation, the information we've we're presenting in Exhibit 22 on page 47 does not account for the impact of OBA changes, as those are not expected to begin to impact customers until this month. As shown in Exhibit 22, the largest spike in closures occurred in what was effectively the first month of closures after COVID, with additional spikes related to phases when the Fiscal Responsibility Act upper age limit changes phased in, and with the end of remaining waivers. The September 2025 increase to about 5,500 closures would be the month that you would first see impacts of the jurisdiction level waivers that ended in June. Those included Baltimore City. In general, except for the months with higher closures due to expanded eligibility, about 1,000 cases per month closed due to the requirement. And between May 2024 and July 2025, about 30% of the cases reopened. Turning ahead to page 49, this talks about the administrative match funding that was provided to account for the administrative match change that begins October 1, 2026 to 75% from 50%. The allowance includes $43.1 million of additional general funds in the local family investment program that's intended to reflect the higher state match throughout the family investment program and really throughout the department. It's unclear if this is the right level of funding because it's not really tied to any particular expenditure. DLS notes that while the fiscal 27 allowance reflects the higher level of general funds, it does not reduce the federal funds proportionally. We've recommended deleting the equivalent amount of federal funds. We've also asked the department to discuss the process by which they will allocate the general funds out to the appropriate programs and when that will occur. Turning to Exhibit 24 on page 52, this looks at the combined impact of the changes on the benefit expenditures. So it takes into account the anticipated impacts of the work changes for the ABOD population, as well as the refugee and asylee, as well as the impact on the benefits from the loss of some of the heat need benefits. It does also show what's anticipated to be the general fund costs beginning in fiscal 2028. DLS is anticipating that the state will need to cover the kind of highest cost share at 15% based on what our error rate has been. And so that would increase from $144 million in fiscal 2028 to over $200 million by fiscal 2030, though the actual impacts will vary depending on the error rate and the benefit expenditures. On the bottom of that page, this looks at the nutrition education program, which was repealed as part of OBA after federal fiscal 2025. Despite the repeal, the fiscal 2027 allowance level funds the program at the level of the budget as introduced in fiscal 2026 before the repeal was known, and DLS recommends deleting the funds that are unneeded due to the repeal. The final issue in this analysis looks at the voluntary settlement agreement that was entered into by the department with the U.S. Department of Health and Human Services Office of Civil Rights in October 2024. This settlement related to disability and reasonable accommodations for individuals with disabilities, particularly in the TCA program. The Office of Civil Rights found systemic concerns, including that the LDSS's lacked a consistent approach for assessing disabilities and related modifications or accommodations for customers to participate in and meet the requirements of the program, and a need for statewide policies and procedures related to providing reasonable modifications and accommodations, as well as staff training, grievance procedures, and monitoring and oversight. The effective date of the agreement was August 13th. Most of the provisions in the settlement agreement were based on the kind of timing after the effective date. In the report that DHS submitted They indicated that on September 9th, the Office of Civil Rights granted DHS a 6-month extension on all of the deadlines in the agreement. Under the terms of the agreement, if OCR determines that the departments failed to substantially comply with any provision in the agreement, after following certain steps, they could terminate the agreement and take additional measures, including reopening the investigation into the cases that were the basis for the agreement and other remedies available under federal law, which could include enforcement proceeding to terminate federal financial assistance. At the time of submission of a report, that was required through budget bill language, DHS reported on the status of 10 provisions with deadlines that had passed as of the submission. They indicated that they had completed 8 with 2 in progress. The 2 in progress items related to the assessment tool. The assessment tools are used to determine a customer's strengths and weaknesses, education level, work history, job skills and readiness, including their health and their disability status, and any other barriers to participation in program requirements. Of the 3 deadlines, the one that they had met related to the assessment tool was identifying a universal assessment tool. The other 2 were related to policy revisions for the new assessment system and implementing the new assessment system. DHS has subsequently reported that it anticipates finalizing and implementing regulation changes in calendar 2026. We've asked the department to comment on how it's working with the Office of Civil Rights to ensure it's not deemed non-compliant for failing to meet the deadlines in its efforts to complete the activities. As part of the settlement, they were required to send out notices to people whose cases had closed due to particular reasons about the opportunity to appeal or reapply. They ultimately sent out just about 6,000 of these notices in the July and August 2025, and they report that as of January 13, 2025, they had not received any appeals, though they said that they had not set a deadline for reapplication or appeal. Turning to page 56, this begins the recommended actions. I'm only going to cover the ones that I haven't already mentioned. So recommendation 2 is to delete funds that were intended to be used to implement departmental legislation that's been withdrawn, and so DLS recommends deleting those. I've covered the next 2 on page 57. This is language that restricts funds pending the submission of data on application processing times, denial rates, and case closures. The item on page 58 I discussed. On 59, item 7 is annual language restricting funds in the assistance payments program to that purpose. Recommendation 8, I mentioned recommendation 9 and 10 on page 60 I've mentioned as well. There are 3 additional updates in the remainder of the analysis related to the share of the TCA caseload that's work eligible, measures of work activity and outcomes, and information from the annual Life After Welfare update. But with that, I'll conclude my presentation.
Thank you, Ms. Zimmerman. We really appreciate your always thoughtful and super thorough analysis. Do any members of the subcommittee have questions? Seeing none, thank you. We're going to ask our Department of Human Services team to join us. Madam Interim Secretary Brown-Burnett and team, welcome. We look forward to hearing your response once you're able to settle in. Thank you.
Good afternoon, Chair Shaddy and members of the committee. I'm Gloria Brown-Burnett, and I serve as the Interim Secretary for the Maryland Department of Human Services. I would like to first thank the Governor and the Department of Budget and Management, as well as Tanya Zimmerman, our DLS analyst, for her analysis of our FIA budget. I want to acknowledge the DHS leadership team here with me today. Augustine Nabaga, I have practiced this. Nabaganamia,
Abanganyimana,
who is our Executive Director of the Family Investment Administration, or FIA, Chief Financial Officer Roman Napoli, and Chief of Staff Webster Yee. And in the audience, our Charles County Director of Social Services, Dr. Tanisha Sanders, is here. I'd also like to take a moment to acknowledge the incoming Acting Secretary, Stacy Rogers, who's joined us today. I will keep my remarks brief. We have included more detail on our accomplishments and priorities in our written testimony and the slides from our HR1 briefing earlier this session. Our vision for Maryland is one where all children and vulnerable adults are safe, children have permanent homes, and families thrive. When we began the hard work of realizing this vision 3 years ago, we knew we had to rebuild trust and modernize a system that had fallen behind. Since 2023, the Family Investment Administration has been focused on making much-needed, long-overdue changes to provide Maryland families with the tools and resources they need to thrive. Today, we can report that this progress is delivering results and continues in several critical areas for 2026. Making benefits more secure and easier to access for Marylanders through new chipped technology EBT cards. Minimizing harm and preserving access to lawful benefits as we implement HR 1 of 2025 with SNAP now and with Medicaid later this year. Continuing to increase access to benefits for Marylanders who are eligible, and making meaningful reforms that continue to bring down Maryland's SNAP payment error rate. We've made some meaningful progress, but hard work remains. As we look ahead in 2026, I want to acknowledge the DHS is in the midst of transition. As interim secretary, I am committed to making improvements to better serve Marylanders. My commitment to you through this transition and beyond is that we will get better every day and deliver for the families we serve. I will now turn it over to Roman Napoli, our Chief Financial Officer, to speak to responses to the DLS analysis prompts.
Okay, get ready. On the first prompt on page 11 to discuss the cause of higher denial rates in recent months and whether any changes to the application process have contributed to these increases, we respond that based on our review to the data, there's no direct cause for the higher denial rates. We are reviewing further to see what changes to either the application process, federal rules changes, or broader economic conditions may have contributed to these increases. Additional information is provided in our written response and the linked JCR for August through October 2025. On ensuring that any budget language restricting the use of sunbucks is followed on page 24, our finance office made an administrative oversight in the 2025 sunbucks administrative funding, and we provided a written response to that effect to DLS last December. Me and my leadership team will be increasing our tracking of JCR language coming out of the legislative session in a more robust manner going forward. We've asked to comment on SNAP General Fund expenditures on page 25 and how they didn't appear to match dollar for dollar SNAP admin requirements. When we received the DLS analysts' analysis late last week, we revalidated our matching and identified the matching amount of funding through aggregation of sources for SNAP administrative funding, not just in NOOG 002, or OG2 as we would call it, and NOO100. Our math shows that dollar for dollar match is there, and that is what we are reporting to the federal government as we close out the 2025 award. On page 28, we were asked to comment on the status of the reimbursement of $2.6 million in state funds used for SNAP benefits during the fall federal government shutdown and our recommendation to delete unused fiscal funds. We concur with the DLS recommendation to delete the unused fiscal responsibility funds, but we note that we have not yet received any formal guidance from USDA on how to submit the reimbursement for these state-issued SNAP benefits. USDA is required by federal budget law to reimburse Maryland, and we will pursue every option until the federal government reimburses these state funds. On page 29, we were asked to provide an update on the status of the 2026 budget language for the Maryland Community Action Partnership. We received the MCAP signed a grant agreement on February 17th and executed the grant agreement award on February 20th. We are now engaged with MCAP on program implementation and the funds necessary to do that. On page 29, DLS also recommends deleting the overstated federal funds portion of the $11.7 million SNAP employment and income verification contract. We respectfully do not concur. This critical contract is used to verify income for various programs such as SNAP, temporary cash assistance, and home energy programs. The risk of not having adequate funding is that we would be forced to stop income checks for applicants, which would inevitably increase the SNAP payment error rate. We initially misidentified the use of these funds in our earlier discussions with DLS, but we have spoken to them and attempted to correct the record. On page 31, we were asked to provide the rationale for not providing the required benefit increases until January of each year, despite having calculated the minimum living level benefit increases. We planned for the January 1st start date because the upstream impacts and approvals required to set accurate benefit levels are not reliably available early enough to support an October 1 rollout. In prior years, these timing constraints frequently caused us to miss the October 1st implementation date, requiring retroactive benefit adjustments that increased administrative workload, complicated system operations, and created confusion for clients. Maintaining a January 1st implementation date avoids these recurring issues and ensures that benefit changes are implemented accurately, predictably, and on time, supporting sound financial management and operational stability. On the DLS recommendation on page 40 to reduce SNAP funding by $200 million in federal funds, we respectfully do not concur with the recommendation and instead support the governor's budget. At this time of economic and federal government uncertainty, we do not recommend that federal funding flexibility be reduced. We concur with DLS's recommendation on Sunbuck's program reports and restricted budget language on page 43. On page 46, we were asked to discuss our collaboration and partnership with MDH and other agencies to reduce HR 1 changes. We have been working closely with Health and the Health Benefit Exchange to reduce administrative burden and maintain lawful benefit access. We have provided separate briefings to the budget committees on these subjects and are happy to discuss further opportunities for partnership. We concur with the DLS recommendation on page 49 to delete the equivalent amount of federal funds to more accurately reflect the availability of funds as part of the HR 1 response effort. We were asked to discuss the process by which general funds will be allocated to the appropriate programs and when this allocation will occur with respect to the SNAP administrative general funds to a single program and FIA. Currently, DHS only has a manual cost allocation tool for this process until statewide systems become available. We make every effort to ensure costs are properly accounted for across every relevant cost center that SNAP admin should be charged against. We are providing increased oversight from DHS financial leadership, which includes myself, and additionally, SNAP-related programs are not subject to the cost sharing, namely Sunbucks or SNAP ENT. We concur with the DLS recommendation on page 52 to delete the 2027 SNAP education funds due to the HR 1 repeal. On page 54 of the DLS analysis, we have asked to comment on our work with the U.S. Department of Health and Human Services Office of Civil Rights and our efforts to comply with the 2024 Voluntary Resolution Agreement. On September 17, 2025, the Office of Civil Rights provided us with written confirmation that we are in good standing with the Voluntary Resolution Agreement. We continue to hold monthly check-ins and engagement to remain on track to complete the remaining VRA activities. And in response to the DLS operating recommendation budget actions that are listed on page 56, we concur with the first budget action to delete SNAP education funds. We concur with the second recommendation to delete $250 to implement departmental legislation. We respectfully do not concur with the third recommendation to delete $200 million in federal funds. We concur with the fourth recommended action to reduce the equivalent amount of federal appropriation as part of the increase in the state share of the SNAP administrative match. We concur that the next item for quarterly reports of our benefits data. On the sixth recommended action for a report on the calculation of the Maryland minimum living level, we concur with the report requested, but ask for a due date of December 1, 2026, in order to ensure that our calculations are correct. Data that our calculations depend on will likely not be available by October 1st, as discussed earlier. We concur with the second recommendation for a budget restriction in GO08 assistance payments. We also concur with the 8th recommended action for a Sunbucks report, but request a deadline of January 1st, 2027 to better align with the time needed to reconcile fiscal data and performance measures. Sunbucks continues to be reconciled through December, and we wish to align our federal and state submissions. We respectfully do not concur with the 9th budget action to reduce funding for the employment and income verification contract for the reasons previously discussed. And lastly, we concur with the 10th recommended budget action to reduce unneeded fiscal responsibility funds in 2026. With that, we are happy to take questions.
Thank you so much, DHS team, for your testimony. Really appreciate it. I'd like to turn to colleagues on the subcommittee, and we'll start with Delegate Heinbach.
Thank you, Madam Chair. Thanks for your response to the DLS analysis. On page 49 to 52 of the DLS analysis, it talks a lot about SNAP error rates. And I think we all know, it explains that under HR 1, if you have an error rate of more than 6%, then you have to start sharing and contributing to. And I think our error rate was 13%. And in the analysis, DLS predicts that even with some more improvement, the error rate will still be above 10%. And because the error rate's above 10%, we pay 15% of the cost, which, as they said, amounts to about $144 million in 2028 and about $200 million in 2029. So if obviously, if we could get below the 10% error rate, then the state contribution drops to 10%. And I just did some quick math, and I'm not good at math, but it would result in a savings, if I did it right, of tens of millions of dollars to the state. So that's not a real thorough cost-benefit analysis, but obviously, if we can invest, we can do things to get the rate down to 10%, then it's in our interest to do that. So I guess my question, after rambling, my question is, can you get the rate down below 10%, or what do you need to get the rate below 10%?
We continue to work with our 24 local departments to address the issues, systemic and otherwise, that cause errors. And we have been very successful over the last few months of partnering with several entities to help us look at those systemic issues, as well as engaging with technology and automation to help us identify where those errors occur most commonly, and put in the infrastructure to address those. And I'll let Augustine comment on it, but that's primarily it. Go ahead.
Yeah, thanks, Madam Secretary. I would note, before I respond, I would note that that the federal government is not helping with reducing the payment error rate. When they increase paperwork, such as imposing additional work requirements, that directly influences whether or not they are increasing payment error rate. Regardless, we are taking many steps to reduce the payment error rate. First, we are continuing to implement to use technological tools to better train our staff to make sure that they're applying the payment, the SNAP policy accurately. Second, we have enlisted organization, civic nonprofit organizations to help us with identifying the root causes of the payment error rate, and so that we know where to focus. For instance, we are working with an organization called U.S. Digital Response. We are working with Code for America to use data to really kind of pinpoint those cases that are likely to result in a payment error rate, so that our staff can focus, can spend more time reviewing those cases. We are also automating processes where we can to reduce the administrative burden, so that our workers can then spend time reviewing the cases they are supposed to do. So in essence, we are implementing a multi-pronged strategy to the payment error rate. Whether or not we get to below 10% it's something that we're driving towards, and we remain focused, and we are looking for partners in helping us continue to identify new solutions, but we are focused on this very issue.
So the Department of Agriculture calculates the rates, is that correct?
Yes.
Yes.
That's correct.
And so, out of curiosity, what constitutes error? What are the largest factors there that errors? What are the biggest categories of errors?
Delegate, if I may address, if you look in our written testimony, we have provided the slides that break down exactly what counts as SNAP payment errors. And so if you look at slide 16, basically there's 3 buckets of potential error. And it's a question of measurement of government, administrative government oversight on operations. There's 3 levels. The first one is staff caseloads and turnover. As my colleague Augustine and Gloria and we've commented and briefed on the committees, we've made enormous strides in hiring FIA caseworkers over the past 18 months. We've reduced the vacancy level down to about 4% on the FIA caseworker side. And we've now are focusing on training those caseworkers because it takes time to bring someone on and then train them so that they're proficient in what they're doing. The second item is system issues. And as my colleague Augustine mentioned, if you look on slide 20 of our written testimony, there's a very specific breakdown by each quarter of 2026 as to what are the technical work that we're doing on the technology side to reduce error. And then the third item is with changes to federal policy, such as HR 1, every time there's either a change in federal or state policy, that increases error because we have to then retrain our workforce on how to deal with that. Also, one item that I want to note, Delegate Heinbaugh, is the next error rate that's going to come out from the USDA will be likely in June of this year for federal fiscal year 25, ending September 30th of last year. It's obviously a question. The feds will release the final official score on whether we're over 10% or not. And then the question then is, how close are we to the national average? So there's a couple very complex calculations there. As to where we are going, as Augustine just pointed out, we're doing very specific steps for this fiscal year, which is almost 6 months in on the federal side.
So are you saying you can get below the 10% error rate?
We're doing everything we can. With the federal government shutdown last October, November, I think we can make an unofficial prediction that our numbers will have gone up then. We've asked the federal government for some type of permission for that not to be counted through the DC office and the federal delegation. A number of states have asked that, including the National Governors Association. It seems like so far the USDA response is, please kick rocks.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. On sort of, just I want to tack on a sub-question before I turn to you, Delegate McCaskill, related to error rates. So we had a discussion with DLS, and you all also talked about why you can't compute the payment amount until January instead of October. Does that have any impact on the error rate? Like the delay of a few months, if let's say the payment amount is supposed to go up by like $40 per beneficiary or per family, and you have issued payments for a few months on the old payment amount, does the delay to January affect the error rate?
No, Madam Chair, it helps us with our error rate because if we know that we're making things work on January 1st, then we can fix all of our technology, make sure that the benefits are appropriately calculated to take effect on January 1st. The issue that, as my colleagues Roman and Augustine described earlier, is if we were trying to rush to get things done by October 1st, the way that our benefit systems are designed, we have to have those calculations ready by usually the 23rd of the month before in order for benefits to start kicking out on the 4th of the next month. And what we found out then was we would make mistakes. And so we're trying to reduce the number of errors we make so that folks are accurate, or receive the benefits that are accurate.
Okay, and the mistakes that you're referencing are more on paying to the stated correct amount?
Yes.
So, okay, got it. Thank you. Delegate McCaskill.
Thank you, Madam Chair. I'm actually still stuck on the question of SNAP error rates, but I'll have to get my mind set for that. First, I just want to commend having the future Stacy Rogers, the future secretary, here in the audience with us. It goes to show her due diligence and also getting in preparation for what's to come. So it's really appreciated to see you here, concentrating on what seems to be the issues here for our committee, because we won't get to question you just yet, because it'll be after session. So welcome. It's just a pleasure to see you. I want to concentrate on two things. One is the high rate for denial again. So as indicated on page 10 of the DLS analysis, the denial rate for SNAP, TCA, TDAP, and PPAA are all high. In the case of TCA and TDAP, it's especially true for denial rates of over 70%, which seems to be such a really concern of waste of time and resources. And so we do understand that Interim Secretary Brown Burnett, in your testimony in the Senate last week, that you have hopes to move to an online portal, which is really a good, moving in the right direction and a positive move, I believe. We also understand that you will be reviewing the application process overall to see where it can be improved. In the meantime, and maybe in the more immediate, perhaps, I'm curious of what can be done. For example, could there be a more extensive public awareness about the eligibility rules or required application information to help those applicants?
So thank you for that question. It's really a double-edged sword, right? So we have worked really hard. We already have online access, and it's accessible by your phone. And so when you have that kind of convenience, people who may be questioning whether or not they're eligible, just go ahead and do it, right? What do I have to lose? I have my phone in my hand, I can apply. So I think you're going to see more people applying who are just not eligible, but they're trying their luck. But the other thing we're doing is, when you talked about a campaign, we work closely with community-based organizations to help them understand what makes a person eligible so that they can convey that information to the people that they interact with on a regular basis. But we're interested in knowing about those numbers as well, so we're delving more deeply into them to understand what the denials are for, and work from there with our community partners to determine if it's a education campaign, or is it just a byproduct of greater accessibility electronically.
So there's a departmental accountability of when those denials happen, that you take a closer look and kind of balk or graph out why those denials have occurred, correct?
It's part of our payment accuracy work as well,
Good.
because we can get an error for paying someone who wasn't eligible, and we can get an error for not giving someone the benefits they're entitled to. So
Okay.
we're doing definitely more work screening, looking at the accuracy, and working closely with our local departments.
Perfect, thank you for that. So per DLS on page 20 of the analysis, we learned that missed interviews are the top reason for denials of benefits. This causes more than 20% of the denials of SNAP. And so we're trying to understand the hurdles with that. Can you walk me through? So is the process still a telephonic process, in person, a mix of, how are the interviews conducted?
I'm happy to speak to that. So last year, last November 2024, we implemented an online interview scheduling system, which was fantastic because we knew at the time that many customers were calling our call center to schedule their interviews and they couldn't get through. And so this online portal has extremely helped with making sure people are able to schedule interview for the time that is convenient for them and their families. So, so the interviews are being scheduled. The interviews are also happening virtually. I don't know if many of you remember, pre-pandemic, customers had to report in person for interviews, and that's something that was burdensome and honestly did not allow people, working families, to be able to access the benefit that they need. So all the interviews are virtual right now, unless a customer insists that they want to come in person, in which case that option is available to them. We have heard instances where our workers call a family and the family refuse to pick up because they don't know who's calling. Like you and I, most people don't pick up phone calls that they don't know. We have made changes in our telecom system so that when a worker from our office calls, it reflects that someone from the local Department of Social Services is calling so that we can increase the pickup rate. Again, we continue to look at that data, also talking to community-based organizations to better understand the additional steps that we can take to increase the interview completion rate so that we can reduce the number of people who are denied for not completing the interview requirement.
Nice, yeah, because I'll roll over, it'll pick up as spam on my phone, and so I probably wouldn't answer the call either. When applicant is denied, is there some sort of grace period, or is a flat-out denial when they start all over again and trying to figure out how they loop in the system?
There's a 30-day grace period. So if someone received a denial notice and for not completing an interview or submitting some kind of required documentation, if that information is received within 30 days, that case will be reopened.
Perfect. Madam Chair, one more bite at this apple. I want to turn to Sunbucks. It's that time of season that we're going to be transitioning for end of the school year. I know that this program has been such a wonderful program to our families during the interim of school, of the school day. And so I'm looking at page 42. So I have two questions. I was looking at page 42, and on the graph it says out of state. Can you explain who would be out of state, the beneficiary of the out of state Sunbucks?
Yeah, very good question. So, as you might know, about 98% of Sunbucks recipients are automatically enrolled in the program because they're either a SNAP recipient, they are already receiving free and school meals, or they're already in Medicaid. The data for Sunbucks is collected from the prior school year up until we're issuing the benefits. So, for instance, when we start issuing benefits in June, we'll be looking at people who are enrolled in the program that made them qualify from last August up to that point, right? So in some cases, some of those individuals have moved out of an out of state address, and the instruction from the federal government is that we should issue benefit to those individuals, and there's a process for making sure that the individual is not receiving benefits in more than one state.
Okay, that was good. Very good. That was going to be my next question. So lastly, on Sunbucks again, because I just want to always make sure that that program, as long as it's available, to work proficiently. I know that each state has to apply by December of the prior year. The process in state here in Maryland, for each jurisdiction, because I see Anne Arundel County, Baltimore City, Baltimore County, Montgomery County, and Prince George's County had the highest amount of participation. Is the process within our state that each jurisdiction has to apply, or they actually, you refer back to that data from the prior year?
Delegate, we've applied on behalf of the state of Maryland with the federal government for Sunbucks 2026.
Okay.
Each jurisdiction does not need to reapply. That was the old state-based program. And so under the federal one, Maryland's already said, we would very much like to move ahead this summer.
Okay, thank you. Thank you, Madam Chair.
I'll probably just add that the numbers you see here is really kind of function of the number of kids, school-age kids in each jurisdiction, more than anything else.
Thank you so much. Thank you for the great questions, Delegate. Delegate Ruff.
Thank you, Madam Chair, and Acting Secretary Rogers and team. Thank you all once again for coming before us and giving us great presentation on your budget. I wanted to touch base on the section starting on page 16 of the DLS analysis, and it goes through, I believe, page 20. And so in 5 of the last 8 quarters, more than 75% of SNAP closures were due to failure to reapply, not ineligibility. So what specific evidence does your team have that these households were no longer eligible as opposed to losing benefits due to administrative barriers? And what measurable steps is DHS taking to proactively prevent eligible families from falling off during recertification?
I'll kick it off and then I'll pass it to Augustine. You might recall that we had the ABOD cases, able-bodied adults, many of those cases closed at some point because of the exemptions running out with the federal government. And so we saw a decrease in our SNAP caseload related to that. But Augustine, you want to speak to?
Yes. So, like you, we're very concerned about cases that get their benefit interrupted, especially if they are still eligible. And that's something that we have been trying to address head on. First, there's 2 types of renewals. There's a semi-annual renewal, so every 6 months, someone has to check in and say, hey, well, my situation has not changed, or my situation has changed, and this has changed. Then there's an annual renewal. So to tackle this specific issue, we just, this past January, we just implemented a process where we are, if a customer reports at the 6 months check-in that there was no change in their household situation, okay, we are automatically renewing those benefits. Worker does not have to touch that case, and it's just automatic. So we believe that the more automation of that type will help reduce the people who fall off because they fail to renew their benefits. Now, the annual renewal, on the other hand, requires that we review a case and verify the information. We cannot automate our way out of that problem. So what are we doing to address that? We are working with Code for America right now as we speak, where we are talking, they're helping us talk to benefit recipients, community-based organizations that work closely with those individuals to identify what specific, where the pain points are, right? You know, what leads people not to submit the application or the paperwork required to renew those benefits. We're going to use that information to work with Maryland Benefits, formerly MD Think, to redesign the annual reapplication process to make sure that it's a process that is working for our customers. Similarly, we are looking at the notices that the households receive when they are due for a renewal. You know, the feedback we have received sometimes is that those notices are not as clear as they should be in terms of articulating what it is that we need from the households. So looking at those notices for plain language and the clarity is an important step in our process for making sure as we design the reapplication process that it's one that is really customer-centered.
Are there bilingual notices going out, and are you using multiple forms of communication like text message?
So our notices are in English and Spanish to begin with. And if a customer has requested translation in any other specific language, those they are also translated in those additional languages. We currently do not have text messaging capability, but great question, because this is something that Maryland Benefit is working on developing. We do believe that by the end of April or May, we're going to have the ability to be able to send a text reminders to customers who are due for renewals and for other reasons as well.
And we've been working on this for like the last 6 to 8 months to put this technology into place and do it under the federal guidelines. So it's definitely something that's been on our minds because we know our people look at their phones. And personally, if I get something from a trusted sender, I click the link and go do what I need to do. So we want to make that available to our customers as well.
Yeah,
And then I
absolutely.
don't want to ignore the federal environment that we're operating in as well around those people not reapplying. We know that there is concern, especially in mixed households, and so that's why we're working, another reason why we're working closely with our community-based partners whom our customers trust around ensuring them that we will protect their information and so that the children who and other people who may be eligible can still receive those benefits.
Right. So I definitely understand the ABA-WD aspect of it, but I think that's not the predominant, at least that's not what the data shows is the predominant reason for the closures. It's the failure to reapply. So I'm glad that you all are focused on that aspect of it. I wanted to know, before you've implemented this first change in January and the new ideas about going with text, which I think absolutely makes sense, of the households that have in this data closed for failure to reapply, what percentage, after learning that their case had been closed, successfully reapplied within 30 or 60 days and were found to actually be eligible?
Yeah, 21% reapply and are found eligible, reapply within 2 to 4 months.
So you would say that's a significant percentage, correct?
21%.
It is a significant number, and that's why we've taken the steps to address that. So.
And so I think that would indicate more of a procedural churn than a true ineligibility question, correct?
That is correct.
Okay. What is the racial breakdown of closures for failure to reapply?
So failure to reapply just means that someone was sent a notice to.
I'm talking
You said
about
racial.
racial breakdown, like
Ethnicity.
ethnic, excuse me, ethnic.
Oh, I don't have that data with me, but we can supply that. Sorry.
Okay. Can you all provide us with that information? Because, this is clearly a equity issue, and we can't have procedural churn be the reason for food insecurity in this state. That's just not acceptable. I want to move on to the TCA hardship exemption oversight. Federal law permits Maryland to exempt up to 20% of TANF-funded cases from the 5-year lifetime limit due to hardship. We're only currently using 9.4% of that federal flexibility. Since 9,709 cases have closed due to time limits since 2023, the end of, so just over 3 years, what affirmative screening process ensures eligible families are identified for hardship exemptions before termination?
Okay.
Go ahead.
Yeah, I can speak to that. So about 60 days before a household reaches the 60-month time limit, they receive a notice asking them to schedule an appointment with a caseworker to go over, to see if they have a hardship exemption that we can use to continue their benefits. If a customer does not reach out to the caseworker will proactively reach out to the household and make a contact. They have a meeting, virtual or in person, to assess their eligibility for hardship exemption. If that hardship exemption exists, the customer will be screened in, the hardship will be documented in a system, and the household will continue to receive benefits. If the hardship does not exist, we are required by law to close those cases.
And for those that we keep open, we have to have the documentation in the file.
Okay, so are you saying that internally, your caseworkers are required to proactively assess the hardship before the case is actually closed? Is that mechanism in place that says, caseworker, before you close this case, you have to proactively reach out to the client?
Yeah, that case exists in both caseworker protocols, but also in our policies that we have instituted over the last 2 years, yes.
Okay, and I'm gonna ask the same question about SNAP benefits. How many families whose cases are closed due to time limit were later determined to be eligible for hardship upon appeal or reapplication?
I don't think there's a time limit on SNAP.
There's no,
Excuse me, I'm talking about TCA still. I was saying, I was asking the same, similar question to what I asked about SNAP previously, about after the case is closed, they find out, they then reapply, or they appeal. How many families
Where the cases
were
are
then
reopened.
determined, or can you give me a percentage of the families that then were determined to still be eligible based on hardship, despite the fact that their case had already been closed?
I don't have that data with me, but we can make sure that's something we'll get back to you on.
Okay, yeah, so those two pieces of data I would very much like, and I think you can go even further on that second, on the TCA piece, to talk about the equity issue as well, or equity piece, to figure out how that is playing out across ethnic groups. You know, at the end of the day, we have to ensure that we're fully utilizing the federal flexibility, and we're only not even halfway there. We have to prevent unnecessary food insecurity, protect families with legitimate hardships, avoid this procedural churn that increases administrative costs. So I would like to see progress from this, this department over the next year that would show that there's a keen focus to addressing some of those seeming to be shortfalls. Thank you. Thank you, Madam Chair.
Thank you, Delegate. Madam Vice Chair.
Thank you so much, Madam Chair. Thank you all. We had previously, I just want to give thanks for the excellent and separate briefings on the anticipated impact of HR 1 that we had previously had. I just wanted to take a second for that. My constituents and jurisdiction, in high percentage, being the third most affected by so much that's happening, the unnecessary pain from the federal government that's come down on our state. So I just want to take a second to say thank you, acknowledge that we are in scary, uncertain times as we navigate this together as partners. On page 48, DLS outlined projections of SNAP benefit caseloads for FY '26 and '27, taking into account increases due to economic conditions. Page 48. It decreases due to HR 1 requirements. As a result, they recommend removing $200 million in federal funds from the budget. We understand from your Senate testimony that you do not concur with this recommendation as outlined earlier, but due to anticipated economic conditions in the state, and that you wish to retain this money in order to fully meet needs as they may arise in FY '27. So can you explain more? I'd like to give you the opportunity. Can you explain more fully why you do not agree? And really, let's put this all on the record with the projections DLS has provided. I wanted to give you that opportunity.
Thank you. I'm going to defer to our Chief Financial Officer.
Yeah, if there's a policy angle, but just on the budgeting side, you know, when we talk about federal funds in this instance, this is about the authority to spend. You know, the federal government makes this funding available to us whether we spend it or not. The only limitation is the state budgeting process, which says we can or can't spend this funding. if we were to give this funding up and say we had another round of federal government firings, all the things that have driven uncertainty over the last year, we would have to come back and ask for that authority back again. And the federal government would say, well, it doesn't matter to us, we already gave you the money. So in this instance, I think leaving that door open, it's an administrative process, but it's a psychological one. It's also a practical one. It prevents the churn of us having to come back and ask for things that we actually already legally have rights to. The state of Maryland is owed this money. If we can find a way to spend it, if there's a legal use for it, it's already our money. So I think I'll stop there, but I think you get my point in terms of, I think it's within our right to keep this door open. Now, if over a trend line, we want to have a longer term conversation about what the trends look like, 4 years, 5 years, the rest of this administration, the rest of into the next, we're happy to have that conversation. But I think for next year, it's important that we have the open door. I think as we saw recent research, over 144,000 federal employees lost their jobs just in the last year, not including contractors and others. So I'll stop there.
Exactly, not including contractors, which also I see quite a bit of in my jurisdiction, as well as my specific district in the city. So thank you so much for answering that. All right, let's move on. TCA and dual enrollment with other benefits programs. Exhibit 31. Medicaid and SNAP have very similar income eligibility requirements. But people who exit TCA still have high rates of participation in Medicaid. Yet, as indicated on Exhibit 31, that's page 71. I should have said that first, not Exhibit 31, but page 71 so you can find it easier. Of the DLS analysis, nearly half of former TCA participants drop out of SNAP within 5 years. Please explain what may be causing this for so many former TCA participants to miss out on SNAP or leave SNAP entirely.
Yeah, so I can speak to that. We probably might be helpful to kind of follow up with a more written response, but I can tell you what I guess is happening here. So, a TCA household leaves mostly because they're gainfully employed, right? But we know at the start of their employment, they're probably like an entry-level jobs, and over time, as they gain more work experience, they get into better and better jobs, right? So the earning is increasing, but as you know, SNAP income limits barely change, right? And so at some point, as your wage is increasing, you become you become income ineligible for SNAP. But that's what I guess is happening here.
So is there a procedure that FIA has in place to communicate with like other agencies like Maryland Medicaid in order to communicate coverage across systems?
Yeah, absolutely. Yeah, we work very closely with MDH and MHP to make sure that customers who are in a program who are eligible for Medicaid and the other programs for that matter have access to those programs.
And that was, I just want to make sure we all understand that was your best, you're going to look into it further and get back to the subcommittee though with a deeper dive for that question though, but that was your initial gut reaction.
That was my gut reaction. I'm assuming this chart came from the Life After Welfare report, and if you look in that report, you also see correlation where, as the wages increase for a TCA leaver, the more likely that they also drop, they're dropping from other means-tested programs, including SNAP.
Okay, well, and we'll still look for that, to receive that from you all. So thank you so very much, Chairwoman.
Sure.
Thank you, Madam Vice Chair. I have just a couple of questions, please. So I want to start on page 29 of the analysis, where it discusses that there's an 11.7 million deficiency appropriation due to a contract for employment and income verification, and that this would align with anticipated contract costs. And then later in the analysis, it says that DHS had noted that the federal funds component might be overstated, but then you all corrected here in your testimony, Mr. Napoli, that, that actually you have a different view now. So I'm just wondering if you can update us, please, on what the current amount you need for the contract is. What do you currently have budgeted, and what amount, if any, is overstated?
Sure. Madam Chair, I'm not Mr. Napoli, but he'll follow right after me. The contract, as initially stated, was created, I think, in 2021 or 2022, and it was for a much smaller account total with a different fund source mix. After, I think it was in 2024, we modified the contract. It went through the Board of Public Works appeal, or Board of Public Works approval process, and the total contract limit is now about $38 million as a contract total. That funding mix has now changed, and so when Augustine and Roman and their teams sat down to do the math, the funding source breakdowns and the various budget allocations needed to be updated for fiscal year '27, and that basically accounts for the difference. That's why there is an apparent federal funding difference when the actual breakdown is, I think, roughly 51% federal funds with debtors, general funds, and special funds.
Yeah, I would just add one more additional item, which is we budget an initial amount for the contract. We let the contract out for the year. It seems as if over the last few years, we have had to modify and add more funding within the cap that's already been approved. But in essence, we have to make sure we have enough headroom, and for things like, the energy benefits, which are going up in '26 and '27, we have to make sure there's space for all of those items. It's not just for SNAP.
Understood. Okay, got it. So at this point, based on your updated calculations, I heard that you said you disagree with the DLS recommendation. And does that mean that just reject it entirely, that the current amount that you have asked for as a deficiency appropriation is sufficient?
Yeah, I think we'd probably be best for us to get back with the very specific number.
That'd be
just
great.
Given the contractual nature of the request.
Very much appreciated. Thank you. My second question is related to TCA on child support non-cooperation. So as you all know, I've got a bill related to this issue, and we've been in discussion with your team about this issue for a couple of years now. So I want to talk about Exhibit 5 on page 14 of the analysis. So this is around TCA application denials due to non-cooperation with child support. So as you all know, an individual who is seeking to apply for TCA, if they are custodial parent, they have to submit the information about the other parent in order to comply with federal and state child support requirements. But I know that there is a little bit of discretion offered to states on when you can create some exceptions. So I want to see, as noted on page 13 of the analysis, DHS has the discretion in closing a TCA case for non-cooperation or reducing benefits by about a quarter. Can you please describe why DHS would choose to deny a TCA application over reducing the benefits?
Augustine.
So a couple of things. I'm going to address the child support first, if that's okay. With I think this is an issue that came up during the last hearing last spring, and after that hearing, we went and issued a policy where we looked into first of all we looked into this issue where people were being denied for child support non-compliance, and what we found was that there were certain immigrants, particularly refugees and asylees, who were being asked to comply with child support requirement, even though the non-custodial parent is not in the country. So we issued a policy addressing that issue. Again, if the parent is not in this country and the country in which they are does not have a cooperation agreement with the U.S., we just waived that requirement. So that has helped. That's why you kind of see the numbers going down, and that was very important. Now, you're right. I think HB 1313, which passed a couple of years back, does allow for partial TCA sanction, but the sanction applies to households that are already active, right? So if you're already receiving TCA benefits and the parent is not compliant, the reduction in benefit only applies to the parent, and I think we reduced the benefit levels by like 25%, something like that. But if you're just applying, if we are applying in that HB 1313 does not apply. It does not apply to applicants. It only applies to people who are already active and not complying with the program.
Okay, well, I know that there's some good cause exceptions that the department could choose to apply, though. For example, if there might be, let's say, some issue that could affect the safety of the child or the custodial parent. Can you talk a little bit about how that works in the context of a new TCA applicant?
Yes, and again, for applicant, those good cause exemptions that do exist, including people experiencing domestic violence, again, immigrant household with a parent who's overseas, and we do not have a way to get them to comply, to fulfill their obligation. There are other exemptions as well, so I don't think I would do a good job explaining, listing all the exemptions, and I'm happy to kind of get back to you in the writing on those.
Sure,
But
yeah.
what I can tell you, though, is that there's a policy in place making sure that we are not unduly imposing requirements on households. And if there's an opportunity to work with this committee and others in finding additional legal exemptions that we can implement, we're very open to doing that.
I really appreciate that generous offer and plan to follow up. Thank you. Further related to TCA case closures, this is my last set of questions. So across Maryland, families and individuals are worried about affordability and the cost of living. So with that in mind, I want to take a look at Exhibit 7 on page 16, which shows a steady increase in TCA case closures. This is something that I know Delegate Ruff was referencing earlier, which has now reached more than 6,000 TCA cases closed. And so, I want to ask, what additional efforts, if any, are you all taking to re-examine closed cases and any that have been appealed for re-examination? And have any of the changes in federal regulations and HR 1 specifically impacted refugees and asylees from accessing support through TCA?
Yeah, so a couple points. The immigrant cases that were closed due to confusing federal guidance that was issued initially have already been reviewed and have been rectified, right? So those cases, I think there were somewhere around less than 100 cases. They were reviewed back in January when we implemented the correct policy, and they were reopened retroactively. So those have been addressed. I'd like to note that no one has yet closed because they are newly subject to work requirements. We do anticipate those changes will start happening in March because that's when the grace period for the 90-day grace period is going to expire. And we are working with the CBOs, the local department staff, to make sure that we're communicating with those individuals to give them the options to seek exemptions where they exist, to make sure that they know of employment training providers in their local community, where there are volunteer opportunities that they can leverage to meet work requirements, and what resources, alternative resources are available in your community if they ultimately lose access to SNAP.
Got it. Okay, thank you. I really appreciate hearing that. Thank you so much. That concludes my questions, and seeing no further from our subcommittee members, I want to take another moment to thank the DHS team for your work and for your testimony. We have 5 individuals signed up to testify, so as is the tradition of our subcommittee, and you've heard me say so many times, please remain in the room, hear from our advocates who are testifying and sharing their views. So because we have only 4 seats and 5 witnesses signed up, I'm going to split it into 2 panels. I have a confusing first and second witness, only in that the first name is the same. I have Velvet Whitehurst and Velvet White from AFSCME. Okay, great. And then is there a second AFSCME witness signed up? Just one. Okay, then we might be able to do one panel. Please, thank you, Ms. Whitehurst. We appreciate you joining us. And I'll add Lisa Klingenmeyer with the Maryland Family Network, Michelle Medeo, Public Justice Center, and Callie Shumitz with the Maryland Center on Economic Policy. And Ms. Whitehurst, you may begin while the others are getting settled.
Good afternoon, everyone. My name is Velvet Whitehurst, and I'm an AFSCME Local 112 member, and I've worked for the Family Investment Administration in Wycomico County for 25 years. With all of the One Big Beautiful Bill Act changes, this past year has been very challenging for both staff and clients that we serve. We have had policy changes affecting SNAP benefits for documented residents, along with strict mandates to reduce error rates. We're constantly reminded that if our error rates are too high, we risk losing federal funding. That creates pressure on every single case that we process. Because of my 25 years of experience, I'm able to navigate these changes carefully and accurately. Recently, I worked on a complex SNAP case with fluctuating income and household changes. By thoroughly reviewing wage data, prior case history, and required verifications, I prevented an overpayment that would have counted against our error rate and caused hardship for the client. Experience helps me catch issues before they become costly mistakes. I also regularly take extra time to walk clients through different processes so that their benefits aren't unnecessarily closed. Meaning, if a person comes in the agency is not able to fill out an application, I can help them fill it out instead of having them go all over the place. That protects families and protects programming integrity. This year would have been much tougher if I were brand new to the career. Experience does matter. Please support a budget that protects our pens and helps retain veteran employees like me. It strengthens our workforce, protects funding, and ensures that we can continue serving Maryland families effectively. Thank you very much.
Thank you, Madam Chair and members of the committee. My name is Lisa Klingenmeyer. I'm here today with Maryland Family Network. We're here in strong support of the Department of Human Services and the programs of the Family Investment Administration. I want to talk specifically about the Temporary Cash Assistance Program, our cash benefits program for children and their caretakers. I did the math. This is my 15th legislative session testifying before you all on this budget, and there's been some great strides in this program over those 15 years, many of which have come out of this very committee, and thank you all for that work. At the same time, there's been some things that are stagnant and some things that are not going as well. The things that are stagnant is that temporary cash assistance, when combined with SNAP, reached 61.25% of the Maryland minimum living level. So we figure out what it takes to minimally live in our state, and still for more than 15 years since we created this program in statute with welfare reform in the 1990s, this program has Marylanders living at less than 2/3 of what it takes to minimally live. So we know budget times are tough, but we will always continue to ask that we continue working, trying to bring families up to an amount that is closer to what it takes to minimally live in our state. At the same time, there's some really troubling trends in the data that DLS points out, and so many of your excellent questions point out as well. We are concerned about application denials. We are concerned about delays in benefit increases and terminating benefits and waivers not being granted. My colleagues will touch on some of these. I wanted to point out in particular the delay in increasing TCA on time. For many administrations over many years, TCA gets increased in October, so it maintains that 61.25% of the Maryland minimum living level. For the past 2 years, that's not been done until January, which means those families are living on less than 61.25% for those 3 months. When it is cold, there are holidays, it is not a time to be giving those families even less than they deserve, which is already less than they can live on. We know you have a lot of tough decisions. We thank this committee for your excellent work. We look forward to working with you in the department to continue to make these benefits accessible for all families, and we thank you.
Good afternoon, Madam Chair, Madam Vice Chair, members of the committee. My name is Michelle Medeo. I'm an attorney with the Public Justice Center and on the Health and Benefits Equity Team, where we advocate to expand and protect Maryland's social safety net and access to health care. We also provide free legal representation in application denial appeals as well as unlawful termination appeals. So I really appreciate the deep and careful review of this committee on the data and share the concerns around the unlawful, or well, we've seen unlawful denials, but the substantially higher denial rates and TCA case closures. So I wanted to speak to that. I also wanted to just flag that in your packets there is written testimony by Ms. Taylor, who shares her family's lived experience with TCA and how critical the benefit has been for her, as well as how the benefit falls short of meeting basic needs given the rising costs of rent and food and the minimal TCA increase each year. So going back to the TCA denials as well as the TDAP application denials, these rates are really high, as the committee noted, and suggest that a lot of people who are eligible for benefits and are applying are getting denied. We see this in the cases we work on, and similarly with the TCA closures over the 2-year period, that closure code for the 60-month time limit. It was a very, very high, unusually high number, 9,700 cases had closed. So I shared some anecdotes in the testimony, but just to share here, worked with one client who was receiving TCA. Her case closed out while she was living in a homeless shelter for families fleeing domestic violence. She had emailed the department documentation that her family was residing in the shelter, and her case still closed out. The reason was you've reached the time limit. Even though she qualified for this hardship exemption, it was not screened for. The department had documentation that she was in a shelter for families fleeing DV, and her case still closed. Her case did not get reinstated until we worked with her and represented her in a hearing before an administrative law judge. Should not be this hard to access benefits, and when families are denied and terminated, they experience several months gap in not receiving the benefit. Thank you.
Thank you, Ms. Medeo.
Thank you, Chair Shetty and subcommittee members. My name is Callie Shumitz. I'm with the Maryland Center on Economic Policy. So the basic income support programs that FIA oversees provide a really essential floor of support for thousands of Marylanders who are facing deep economic hardship. And when these programs are accessible and adequately funded, they reduce poverty, they stabilize families, and circulate money back into our local economies. But I just want to highlight a couple items from our written testimony, which covers a broader range of issues. So first, as DHS continues to implement the changes to SNAP that are required by HR 1, we strongly support providing sufficient funds for the staffing and technology updates needed to prevent people from losing their food assistance due to administrative barriers. We've had a lot of conversation about how those can impact people today. We're also urged the subcommittee to look at finding funding to provide food assistance for the refugees and asylees who are no longer eligible for federally funded SNAP. We know there will be legislation from Delegate Shetty that you'll be hearing in a couple weeks. So we strongly support that. Regarding TCA, as we have shared in the past, we remain concerned about the significant amount of TANF funds that go to child welfare, foster care, and adult services. While those are also necessary programs, they are not core functions of the TANF program, and we would like to see more TANF funds going to cash assistance for kids and their families. While the TCA benefits do go up slightly year to year, they are still fall short of an amount that is truly what is needed to stabilize families and ensure that they can afford the basics. We think there are opportunities to adjust policies and get more money to families, and even looking at some more creative models like the RX Kids program in Michigan that can really expand the reach and impact of our limited TANF funds. At time, so thank you.
Well done. Thank you so much. Delegate Ruff for question.
Ms. Shumitz, thank you as always for your commitment to equity, financial equity in this state. Can you give us more color on the Michigan program?
Yes, so RX Kids is it's a public-private partnership. that they're using some of their TANF block grant funds. There's a thing you can do, it's called non-recurrent short-term NRSTs. So it's like one-time payments that there's a lot of flexibility to get additional cash to families outside of the routine cash assistance that we provide through TCA. So they've used this to just get additional money to families. I can provide some, there's been a lot of research and stuff I can share with you, but it's been a very effective program in stabilizing families and providing, particularly in Flint, Michigan is where it started. They're working to expand it to other parts of the state.
Got it. And then, okay, so I'm interested in that. I'll definitely take another look. You guys heard my questions about the closures. What is your, I think you probably have a opinion about that. Could you give us your take on those issues with SNAP and TCA?
Sure, on the closures and the denials?
Correct.
Thank you, Delegate Ruff. Yeah, I think there's a lot of different closure codes and denial codes that we see at our office where folks receive those codes but actually are eligible. So just to give some examples, with the TCA denial code for noncompliance with child support, what we see often is the department will refer families that are applying for TCA to child support to comply with child support without conducting a screening on whether the family might qualify for good cause. So just, I could give examples, but I guess to stay focused, a lot of families who are seeking good cause, and some people don't know that good cause exists, right? And it's on the department to notify them, but even when families do know that good cause exists and request good cause at the application stage, they're told you still need to go to child support and apply for child support. Good cause you can discuss later. But the example I think Delegate Shetty gave earlier of, a family who is fleeing domestic violence and has safety concerns can't, the family can receive good cause for non-cooperation with child support due to the safety concerns, but if they have to go to the child support agency, if they're not able to, they're not going to go, and their case is going to get denied. So I think that's probably why in the denial rates, that's a top denial rate for families. There's also a lot of families who are living with disabilities in the TCA program. Certainly the TDAP program, presumably everybody who is applying. It's a program specifically for individuals who are living with a disability expected to last at least 3 months or longer. So I think a lot of folks actually need assistance with comprehending notices, might need reasonable accommodations. The department is currently in a 3-year voluntary resolution agreement with the Federal Office for Civil Rights as a result of a series of systemic disability discrimination complaints that were filed. So disabilities, non-cooperation with child support. I know the committee also brought up the question of these, the new online system for phones, scheduling appointments. What we've seen in our office is folks will get notices saying you have a phone appointment scheduled, but then the phone call doesn't occur. So then you call the 1-800 number to say, I waited all day by the phone, no one called, and then you're told, we'll send out another notice. And it's this cycle, and if you go in person, you're told just wait for the phone call. So a lot of times, there's these notices that you missed your phone call, and then which would have been a phone interview, and then you get denied or closed as a result of that. And I think it goes to the churn rate and your case closes out, then you have to reapply, and the high percentage of folks who are eligible who are just getting denied and closed out either at recertification or when there's a phone appointment needed.
Got it. I'd love to continue down this rabbit hole, but I have to chair my own subcommittee in about 10 minutes. So,
I was just going to remind you, sir.
I'll leave it at that, but thank you all very much for your advocacy, especially to you for your work and your expertise and the way you've assisted your clients as well. So thank you so much.
You're welcome.
Thank you. On that note, appreciate this panel for your testimony. Really appreciate you as well for your state service. Thank you for supporting clients through some of their most challenging times, and really, kind of being one of the best parts of our state. So thank you. That concludes testimony for this budget hearing and our budget hearing altogether. So we'll see you all next time. Thank you.
Thank you.